And now let's welcome some discussion with our round table. And this is looking at emerging countries' access to innovation. So to moderate this session, please welcome Anaïs Lekorvac, who is the co-founder of ClickLab, and her panelists and guests, the exec director of the Pasteur Network, Rebecca Gray, the vice chairman of Fiocruz, Marco Krieger, the partner and co-head of ventures at Trill, Nina Rawal, and joining us remotely, the co-founder of Univercells, Jose Castillo. Anaïs, I leave the floor to you.
Okay. Good morning, everyone. I'm not sure if we can see if Jose. Hi. Good morning.
Hello.
Nice
Hello.
to see
Sorry
you
not
here.
to be there, but and thank you for giving me the opportunity to stay in Belgium for today's session.
Thank you so much for joining. So I have the pleasure today to moderate this session about emerging countries. Initially, we had some discussion to prepare this roundtable to everyone. So we're not here to have an ethical discussion about innovation transfer to emerging country. We're here to have a very lively discussion about very practical challenges, but also great opportunity you can find in emerging countries in life science. So I would like to maybe first have an introduction of who you are next to me and online. So maybe Rebecca, would you like to tell us who you are?
Sure. There's many versions of who I am. I'll tell you what I do professionally. So I'm the executive director of something called the Pasteur Network. It's actually called the Pasteur Network. It's not because I'm speaking English. And it regroups 33 institutions around the world, some of whom are called Institut Pasteur of country, some of whom are not. They are largely public institutions, of which 2/3 are located in the global south. And we have, all of the institutions are autonomous, one of which is Fiocruz, and Dr. Krieger apologizes. It's 3 o'clock in the morning for him right now, so it was a little tough to wake up. And they agree and work together on a series of projects and themes, which are just different strategic pillars. The first of which is epidemic preparedness and response and all that that entails. The second is in research development and innovation. The third is on multidisciplinary knowledge communities, which is just sort of jargon for getting people to talk to one another. And the last one is equity and everything that it encompasses. And part of equity is also equity of information and sharing. And one of our biggest challenges, and why I'm so happy to be invited here to discuss, is we do have a lot of startups within the network, which would benefit greatly from a discussion with all of you and figuring out a way to have their ideas be concretized into something which is useful for populations and also is profitable.
Nina.
Thank you. Thank you for having me. So my name is Nina Rawal, and I head up the ventures strategy at Trill Impact. We are a fully for-profit impact investor. We're investing across private equity, venture capital, and micro loans, micro lending, with the overarching goal of advancing the UN Sustainable Development Goals, but for market rate returns, really sitting at that intersection of profit and purpose. And so, just a backdrop of our perspective on impact and emerging markets. I grew up in traditional venture capital, if you will, saw the transformative power that venture capital has on the life sciences, but have also done a lot in my free time in the NGO space. And we had the pre-conversation of how global health and life science tends to become somewhat ideological. Either you're in the kind of for-profit space and then it's $2 million gene therapies, or you're in the non-profit space and then it's about handing out food, if I exaggerate a lot here. But so really thinking about how can you use the transformative power of venture capital to address the 6 billion people that sit in middle-income countries. And I think you don't need to be an economist to realize that there's a commercial opportunity around catering to the 6 billion for a product that you might well already have developed for high-income countries. So that is really kind of the origination of what we try to do. And today we summarize that as kind of focusing on underserved patient groups, and we focus on other groups as well, but thinking about how to accelerate market access outside high-income countries, or indeed, finding products that scale really well globally is one of our focus areas.
Thank you so much, Nina. Jose? Oh, Jose?
Okay. Yeah, sure. So I am actually Jose. I'm co-founder at Universals and leading Quantum, one of our technology subsidiaries. And so we are actually in the business of developing innovative biomanufacturing technologies for viral-based products, so viral vectors, viral vaccines, gene vectors on one side, and for synthetic biology, so RNA first, but also synthetic DNA. So heavily involved in innovation, but from the biomanufacturing perspective.
Okay, thank you so much. So I will start the discussion. Basically, today the idea is to understand a little bit better challenges that you may encounter, but also opportunity, because we want you to get out of this session thinking, okay, we need to look at emerging country right now. I've been working with the European Commission in the past. They've done some in the last few years, especially with Africa, but also with Latin America, to cooperate on higher level, let's say, on health. But obviously that comes with challenges of connection, of not knowing where the companies, their local partners, so it takes time. But I would like to ask you, in your own experience, Rebecca, for example, what are the main challenges you face with working on health with emerging countries or middle income?
I think just if we step back and we just focus it on innovation in the health space, I think the first challenge is, I'm sure many of you have read this, but the World Bank recently came out with an estimation of country investment in R&D, and what they came up with was it is extremely unlikely that investment from governments will ever go above what it was pre-pandemic levels. So the biggest challenge is a lack of investment, and that lack of investment comes for many reasons. Many of the countries in the global south, or ones that I work directly with and we work with, are ones where the vast bulk of their finances have to be directed to other things, and so R&D and research comes very far down the list. So as a consequence of that, many of these institutions need to rely on philanthropy, on other donations, which is highly problematic because those are not really sustainable business models for any of you that deal with applying for grants or working with philanthropies. It's extremely difficult to maintain that over time. And so they're looking at different ways to create models which allow for sustainability and allow for ideas which are often difficult to uncover to be something which are seen and heard by potential investors who can then scale up their model across their own country and area, but also beyond that. I think the second challenge is one which is non-trivial, just deals with language. And multicultural communication. It's extremely difficult. Many people would have, it's a difficult way to converse. There's a certain vernacular which is used, even in this room. There's certain words that are used which lots of people don't understand, and vice versa. And so a lot of investment needs to occur, ideally, in understanding how to communicate in between these different spaces, and an understanding of how to pitch, how to discuss, how to do things. And by doing that alone, many ideas which are often not seen are things that could come to the forefront. And then the last challenge I would just say, which is important about that, is just the fact that this is really hard. It's hard for everybody, even when you have a lot of money. And so for people that don't have any money and are trying to do this, it's even more difficult.
Thank you so much. Nina, your challenges.
Yeah, I think it's really this, in some ways, artificial division we see where the typical life science startup will focus on US. I mean, when we talk about regulation, and everyone in this room understands US regulation more probably than in some ways European regulation for logical reasons. But so a lot of focus on US, EU, Japan, and then the rest of the world is kind of an afterthought from a traditional perspective. I think that's a real challenge and a lost opportunity. I'm sure it stems back to some of the points you make around not having the same understanding for those markets, not having the same kind of experience around the table and so on. But I think that's an unnecessary barrier we put up when we think about how to scale a product globally. I mean, you know, because these products are obviously I think there's this old world notion that people in low-income countries die from malaria and people in high-income countries die from Alzheimer's. But actually, if you look at, you know, global burden of disease, we die from the same, the burden of disease is the same, and more people die from Alzheimer's across LMICs than from malaria. So finding that way of developing a product and making sure that it's actually globally scalable, I think we created that. And it's not like I don't understand why, but I'm saying in 2024, I think we created that challenge, but it's also a real opportunity to think about that scaling differently.
Thank you so much. Jose, what is the main challenges? Because you're a very practical case.
Yes, indeed. So, of course, I don't want to repeat what was said, but for me, the very first challenge when we enter into a conversation and people are obviously convinced that as they want to build up, their own biotech industry or pharma industry, they are very much interested in innovation. First challenge is funding. So I won't repeat what both Rebecca and Nina said. Is funding, very concretely speaking, you have a technology, people are interested, they need to buy it, and there is a lack of financial resources. But so I think Rebecca mentioned many people, including us actually, are working with foundations, NGOs, charities, and the like. But for me, probably the most important challenge is that nobody can focus only on innovation. From my perspective, and being actually a technology provider, technology is not a goal; it's a means to an end. And for players in middle-income countries to succeed, there is actually a massive investment that is needed to create an ecosystem that starts in R&D. But R&D means actually how do you invest in R&D if you don't have a health strategy for your country or for your region? So it's R&D, it's a local, a national strategy. Then it's development. It's obviously development using the most innovative technologies that are available today. You also need to be innovative to train all the national regulatory bodies, because at the end you want the products that are the result of the R&D that is using innovative technologies to be registered. And then obviously at the end you want these products to be provided to your population. So for me, this is not, if I'm looking at with my narrow angle as a technology provider, this is not my immediate concern. But actually, it's a long-term concern for all these investment to create a sustainability in the next 15 or 20 years.
Okay, thank you very much. So now we have the challenges, but looking towards opportunity and what can we do better in the future. So the question the other way around, what are the opportunities or any good concrete example that you have of this innovation transfer? I'm sure you have plenty. But yeah, Rebecca.
I think in terms of opportunities, and we've touched on this before, one of the big opportunities comes through supporting and ensuring that the public, nonprofit, and the private sector are put together to have the same conversation at the same time. That's extremely difficult to do. There's some great examples of that, particularly in Asia, where there's a concerted effort to look at trying to do that in a different way, particularly in Hong Kong, where that's an investment. And what that means is that it necessitates training scientists and entrepreneurs to be business literate, and training people in the private sector in business that have the money to be scientifically literate. I think it works both ways. And there's not a lot of investment in that right now, but doing that alone would be extremely beneficial. There's several examples of that within the network that that I attempt to put together. One of those is called the Lab Plus program, which is in Uruguay, which is an incentive-based mechanism to help startups in the life sciences sector. But they have extreme difficulty being in contact with all of the people in this room and looking for at other examples. It's really hard to do that. Uruguay is, I like Uruguay, I'm not trying to say this in a derogatory way. It's a little bit difficult to get to. It's very small, and it doesn't have a presence economically that makes it an interesting place to invest, but it does have an extremely talented and educated workforce dedicated to these programs. The second thing deals with innovations around regional manufacturing, which are occurring right now across Latin America, it's a little bit more developed, also on the African continent, and looking at how to develop and ensure that the R&D chain develops products which are adapted to the population. And those don't necessarily require very large investments. It just may mean that your cold chain requirements, you have to do another step in order to do that before registering your vaccine or having it be pre-qualified. And those things make a huge difference to relieving the burden on the population. And by discussing it with the people directly, those little tweaks can increase the ability of that product to scale and can ensure that it happens. The last one, I think I'll use, again, vaccines as an example of that, would be the development of products where there may not be a market. And the best example of that I can think of is the development of Menafrivac. I don't know if any of you know what that is. That's the conjugated meningitis vaccine, which was developed in partnership with the Serum Institute of India. And it's arguably one of the greatest public health successes in the meningitis belt. And making that vaccine in a way that was a win-win scenario for the population, for the original patent holders, for the manufacturer, was something which is arguably a major contribution and has great spin-offs for all of the people who are involved.
Very nice. Nina, good examples.
Well, we talked about the opportunity, and I think, let me frame it by saying like this. I had the opportunity to meet Melinda French Gates a couple of years ago, and I asked her, this thing about why are we so few people that see the business opportunity in these underserved markets? Like, where are we? Why are we so few? I think she summarized it so well. She goes, well, you should ask the shareholders of BioNTech. This was just after the pandemic. You should ask the shareholders of BioNTech whether they see the opportunity from a commercial perspective or not. So I think the commercial opportunity, whether it's pandemic preparedness, whether it's tapping into these big volumes of people that are currently underserved, or other examples, I think the opportunity can be huge. It is about some of the cliches of challenging the status quo and thinking about the opportunity in a little bit different way. And so that's the opportunity. And I'm going to offer you a great segue to what I'm guessing Jose will talk about. I don't want to steal that thunder, but I think Jose and Universals is a great example of a new partnership they have with Serum Institute of India, which will really challenge. I'm going to get back to it because I'm sure you'll talk about it, and I don't want to present it before you do. But I would like to make a comment on the demonstration of what potential there is around thinking about affordability. So I'll let you talk, Jose, and then I'll come back.
So, Jose?
So thank you, Nina, for the introduction, because this is exactly, of course, what I wanted to share today, is indeed that the big innovations have the potentials to challenge, as you were saying, to challenge the status quo. And myself, I was very much surprised. I know Serum Institute of India for the last 14 or 15 years. I have a very good relationship, and so I visited them in February 2023, so a year and a half ago, just a visit to tell them, what, guys? No, we are developing this, I think, great synthetic biology technologies. I would like to collect your feedback. What do you think? Would there be opportunities? And, my thought when I was there was to talk about, the mass production of prophylactic vaccines. And a year later, so this year in February, we communicated, we published a press release disclosing actually the agreement we have with them, which is to use new integrated advanced synthetic biology technologies to make personalized treatments available and affordable in India. In India for India, obviously, but then in India for the world. So today, and I totally concur with what you say, we need to, and I think that the movement is now ongoing, we need to move from a relationship HICs to LMICs to a relationship that is equal to equal. We have tech, you have needs, but you have ideas, we have needs as well. And for me, that was a total surprise. And they told me, we love what you do, but actually, you don't know yet what we want to do. What we want to do, you can never imagine. And so for me, we are today in, really at a tipping point where new technologies with the firm intention to change the world can actually change the world and create indeed incredible opportunities.
Can I jump in?
Absolutely.
Because I think that the collaboration between Serum Institute in India and Univercells is an amazing example of, for those of you who don't follow, cancer vaccines, and by the way, BioNTech now announced, of course, that they're going to focus on cancer vaccines. That's a whole conversation in itself. But, this is an area where my colleagues in the venture industry are very, very active. Personalized cancer vaccines is the next wave of innovation that we will see. Moderna is there, BioNTech is there, everyone is there. VC is very active. So, in this, I spoke before to this kind of separation between what happens in premium innovation in the West, if you will, if we're, stereotyping a lot here, and then there's the, focus on infectious disease in the East, and, they have their own problems. All of a sudden, you see this integration where the biggest vaccine player in the world comes to Univercells and says, we love your tools. Let's take on, personalized and off-the-shelf, I suppose, cancer vaccines from an affordability perspective, of course, for the Indian continent. That's why they're doing it, but also for the world. And I think I'm so fascinated to see where this is going to go. I really hope you guys will be successful, because I think it will be the first of many examples, to your point of saying, whether it's China, and who knows where they go in the geopolitical context, I don't know. But I think if you look at the pharma industry in China, and also the ingredients are there in India as well, for going from being kind of the provider of the world to leading the charge on innovative, affordable pharma, everything is in place. And they, of course, understand the needs of what an affordability play looks like. So I think this is a really perfect example of how it's not the do good for the lower income part of the world or the super innovative for the high income part of the world. It's really a combination with affordability at the heart of it.
Yeah, indeed.
Absolutely, please.
I totally agree with you, but we still need to deal with infectious diseases.
Oh, yeah, we invest in vaccines, don't get me wrong. But I just think, I just want to move away from this old world view that LMICs only suffer from infectious disease. They suffer from cancer. And my perfect example is always, I worked for Médecins Sans Frontières for many years and so on, and they always say but why do you care about innovation in gene therapy? Because in sub-Saharan Africa, people don't have access to basic healthcare. And I always say, I understand, but for the lady who's dying of cancer in India, I'm not sure she cares. She wants access to affordable cancer therapies, and that's why I love this example, that it's not only innovation in infectious disease.
Yeah, no, totally. And I will, because you're going to the next points, but no, please, that's what we wanted it to be, a more interactive conversation. By the way, there will be time for questions, but if you have any burning questions, just raise your hand and we'll take them. But actually, when I was involved in a project that was on pediatric cancer, actually with Latin America, and Uruguay, one of the countries, and Chile. And after 5 years of that, we even did innovation contest over there in South America, and that's where I'm completely fully aligned with what you're saying, because there's a lot of innovation going on everywhere. Obviously, you have the big research and innovation infrastructure needed, for example, for cancer research, but in that one in particular, a lot of it was related to digital health and to bringing new apps to the market and so on. So there's a lot of things going on, and as you said, we need to stop just going, north to south, but actually there's a plenty of opportunity to collaborate. And I think once you know better, you need to know, but you need to have, I guess, touching points on the ground to understand better the situation. So anyway, please keep on. If you have any, also for innovation transfer, because you say we talked about cancer, there's obviously the infectious disease, but how do we involve better the local ecosystems also in the emerging countries?
Go ahead. I'm going to leave it to you, because I just want to make one brief comment to say, I feel like that's what I mean by ideological. I feel like when we say, and I don't mean you say it, I mean in general, that when we say we should stop kind of thinking from the north to the south, sometimes I feel like people perceive that as like a PC comment. But my only ambition with this conversation is to say, no, it's for the business opportunity, because they understand the needs and we don't. There's the business opportunity in that. Sorry.
No, I was just going to say, but to pick up on your point about touch points, I think that that's an interesting place to look at, which is the touch points are in many locations, and having there be more involvement and reach out to the organizations which are conducting the R&D in different locations is a simple way just to do a scoping exercise, to look at the market, to look and find new ideas, but there's very little contact in that respect. And I acknowledge the fact, and I mentioned earlier that language is a big issue on top of that, but also travel is a big issue, money is a big issue, and also training. And so if there's anything that can be done to encourage the innovation and to see where those ideas could potentially emerge, it's by having more and more contact between the private sector, the public sector, and the nonprofit sector. And that today is unfortunately not the case. We could do better.
Jose, how do you involve the local more? I mean, you talked about the Indian case, obviously, but any other interesting adventure you have?
Yeah, maybe one of the the topics I could share is that referring to what Rebecca just said, at our we are a small company, but at our level, we always try to establish, when we work in a certain country, to establish relationships with the local university or academic ecosystem, because we think that, as I was saying initially, for an innovation to be a success, at the end, the success will be measured on what this innovation will produce as a pharmaceutical product, a vaccine, for example, for the market, for that specific country. So this is something that we have been doing since the beginning of the company. And so we have today relationships with universities in Dakar, where we have a big program with the Institut Pasteur of Dakar. But we have the same in Colombia, so in Latin America, in Ecuador, the little country next to Colombia. And I think that this is key, and you just said it, to really understand, talking in a very close relationship with the people who live the situation of their country, to understand the needs. So for me, early R&D, of course, we are a tech company, but for us, early R&D is one mean to really understand what are the needs and to try to translate them into technical solutions.
Okay. Then, so we're getting to there because we want solutions at the end of the session. So we have a few more minutes to discuss potential solutions. So Rebecca, you mentioned that there's need for more, let's say, interaction, connection. How do we do that? Because at EU level, and now I'm talking more on the policy side, they do this matchmaking events and so on. So I think I've seen, especially one in my previous role as a director of this cluster association at European level, some companies come slowly to show interest. And as you said, again, where there's a business opportunity, and I'm absolutely convinced of it. So, but what else should we do to push this, to connect better, for example, with all the Institut Pasteur around? What is the...
Well, I think that's a good example, is by having touch points and discussions with large networks which englobe R&D entities or research entities which span different geographies around the world. I think that that's certainly one way to do it, because you have a very easy entry point into discussions with many types of diverse groups. The second way is by ensuring that when those discussions happen, that people from those geographies are invited to the discussion. Sometimes that's unfortunately not the case for many obvious reasons, but thinking about it in that respect. I think the third thing is thinking about how the models may be different in different geographies and in different locations. It might not be the same way to do innovation in one place versus another, but you can get to the same endpoint by a different process. And thinking about that. I think the last thing is by simply investing in networking and communication among people that may have some ideas which could potentially be scalable around the world.
Nina, same question.
Yeah, so again, from the business perspective, I think it's about, if I have to get concrete, I would really like to make sure that going forward we have Chinese and Indian, the ecosystems of China and India there. I'm thinking specifically about the Serum Institutes of India, the Shanghai Pharmas, the players that will actually scale these products, because they do a lot, they know a lot, and their voices are fascinatingly absent, I feel, in the when we talk about partnering. And I'm not saying it's easy. I mean, I have portfolio companies that have partnered with Chinese pharma players, and it's really hard. I think we all know that, so I'm not trivializing the challenge. But I think that's a voice that is surprisingly missing from a business perspective.
Okay, Jose, for your fellow entrepreneurs.
But say the question again, Anaïs.
Yeah, no, I basically like to know, there are opportunities, clearly, but what else is needed? Like I said, there are, I know you participate in some matchmaking events or connection, as Rebecca said, to also the local R&D ecosystem. Anything else? If there were money on the table, where would you spend it to promote this collaboration with emerging?
I think for me, I'm sorry to always use the same word. It's building ecosystems. Mm-hmm. And today I really see, I really experience a big change after COVID. And I have, for me, the wonderful example of the Institut Pasteur of Dakar. Mm-hmm. So for me, this is a great example a great example for many countries. It's not just about technology innovation. It's about a country or a regional strategy. And for me, this is, should I have access to a couple of $1 billion? This is what I would repeat in several locations in the world.
Okay. Good. So if there's any $1 billion in the room, please let us know. And yeah. So I just maybe, yes, question. Thank you. Please just introduce yourself and ask your question.
I'm Eric Louvel. We operate in Japan and Southeast Asia, especially in Philippines. I'm not sure that we are asking the right questions. Do we have a pricing issue, challenge, or do we have an expected price issue? We see so many companies coming to Japan or to Southeast Asia with an expected ROI of 2 years and stratospheric price, and this is obviously a problem. In this country, and I include also Japan, which is seen as a kind of biosocialism, there are two markets. A private market which served wealthy elite, where prices are free, and people don't care, the price, I mean, and you have the mass market, And then with the mass market, you need to talk with the agency, and what the agency wants. If you go to the agency, especially the Japanese agency, and you start to talk about your price, your stratospheric price, you are not going to be welcome, It doesn't mean that there is no market in this. There is no private. It doesn't mean that there is no private market or public. There are, but we need to adjust to the medical needs of these countries.
Thank you very much for putting us back on track on the title of the session. But we thought in the discussion that's how it went. So any reflection on the pricing, Nina?
You know, I think that's a whole session in and of itself. Maybe that was supposed to be the session, I don't know. I think South Korea is an interesting example of tiered pricing, right? The same antibody can be sold for $4,000 in South Korea and $24,000 in the US. So I think tiered pricing is real. It happens all the time everywhere. So maybe that doesn't answer your question, but that's my thought. I think tiered pricing happens every day. And I don't have a solution to the overall pricing conversation. I think it's really tricky, so many nuances to it. But I think the only ambition from our side is to say the world is structured the way it is. High-income countries have the ability to pay. But once you've developed a drug for those high-income countries, there's an opportunity for a business case. Like if you think about it from the opportunity of expanding your business case, then a lot of companies do, in fact, move to very different tiered pricing mechanisms in the second step. And I think that that's actually the angle I'm coming from here.
Rebecca?
I like the conversation on pricing. The only thing I would bring up is there's one example, which I think is an interesting one, which is the PAHO model for Latin America with pooled procurement for vaccine pricing, where they've set up a different system. So there's that. And then the second part is the obvious thorny problem, which is nobody wants to produce anything that isn't going to get bought. Right? That's the major fear. So when certain governments are able to guarantee purchase, irrespective of whether the products are used or not, it definitely changes the incentive for the manufacturers. And I admittedly say that that's extremely impossible to do everywhere. That's a unique confluence of events, which is, you know, coming out of Brazil and the manufacturing there and in PAHO. But it's a very interesting model. The second thing I think with that is there are different pricing schemes coming out in different places. Jose was mentioning Pasteur Dakar, which runs an entity called Diatropics, which is the first entity to manufacture RDTs on the African continent on a large scale. And they have like a Netflix subscription pricing model where you sort of pay a flat fee and then you can sort of watch all you want, get all you want for the month, and then you pay something the next way. I think there's many creative ways to look at this, which are ones where you do get a return on investment, but are ones which fit the local population, which may be different in different places in the world. I don't, unfortunately, know a lot about how the market is constructed in the Philippines, but Asia is definitely a place where there's many different examples of how that pricing can be done.
Thank you. I'm not sure if Jose is frozen or not. Can you hear us?
I do hear.
Okay.
I do hear you, but okay.
Yeah, we got you very.
But indeed, I see myself frozen on top of your head.
No worries. Do you have any thoughts on the pricing?
Yeah, for me, it's exactly what was said. So, you know, ourselves as a technology provider, you know, when you market your technologies in European countries or North America, usually for a value-based price, which is, you know, standard, and people are used to that, and is totally accepted. And of course, that price, if you offer that price to, you know, a potential customer in Thailand or Botswana, they will tell you this is not payable. And so it's up to us, you know, to have a pricing strategy that is, you know, viable for the countries where we want to develop our business on one side, because on the other side, I'm always talking about the financial sustainability of my customers, but I also need to take care of my own financial sustainability, obviously. And so this is usually and it's, you know, commonly accepted the way we work. A customer on the West Coast in the US won't pay the same price for my tech as a customer in South Africa, obviously.
Thank you, Jose. You have a question, and then we'll wrap up.
Yeah, no, it's only a private, personal experience. I've been in charge at Sanofi of vaccines in Africa, you know.
And I opened the first affiliated company in South Africa. And I have been a director of Pasteur in this institute also. So I was involved with Montevideo, with Seoul, with Shanghai at the time. And I can say to you, a very big, and I have tried all my life, to transfer technologies to those countries, even when I was at Sanofi for hepatitis vaccine or HIV screening. And the big difference is the country, the culture of the country, the experience of the country. I remember very well speaking with the former director of Bangui, and after he moved to Vietnam, and he explained to me, because they were making and wishing to make some local manufacturing, it was completely different. I am not, I was in charge of Africa, and the reason why the chairman said, I am sure you will not, you're not racist, so it was, because I am not, because my personal origin, if I can say that, and and he said to me, when I was in Bangui, I had to block the people to don't leave their job at the end of the day. In Vietnam, I had to push them out to say to them, you need to sleep and you need to rest. So there are very strong local differences. So it will change, you have education, but this is very, very, very important. Even in Africa, Dakar is very different from Bangui, to take an example. In Dakar, historically, they have been always interested to develop local manufacturing for yellow fever, So I think it is very important. It's something you need to take into account. The success needs to have interested people, hard workers, wishing to develop their country, to serve their country. So it's something you need. The cultural aspect is very, very important. Local.
Yeah, and I think actually there's a session afterwards towards the US and so on, and it's always the same. You have to understand better the local. So just wrapping up, I know we're just gonna pass a few minutes, but I would just ask your last thoughts for the audience and to engage for further development with the emerging countries. So Nina, maybe?
I think, to summarize, I think we all know in this room that life sciences is a truly global industry. Our products tend to be globally scalable, and so the best advice I would think to myself and all our companies is really, how do we lay the foundation to capture that global potential of the product we're developing?
Thank you. Rebecca?
No, please invest. I don't know what else to say.
That's amazing.
Other than that would be helpful.
Thank you so much. Jose?
I would conclude that I see incredible opportunities in LMICs, and from a personal perspective, I see a great opportunity to combine financial success with social impact. And this is something that really drives us every day.
I couldn't have said better conclusion. So thank you so much. Please, round of applause for the wonderful speakers here and online. Thanks again.